I am at the Lanserhof clinic at the Arts Club in Mayfair. Incredible facility here. I am going to be sitting down with Dr. Sam Botchey, well-known MSK sports medicine consultant, and we're going to be talking about his role within the organisation here. It's the first time that I've been here actually, so I'm looking forward to seeing it. It's got an amazing reputation. Dr. Naeem Ali is a good friend and has worked here previously. So yeah, we're going to have a look at the facility, hear more about the Arts Club, which has been going since 1863, I believe. So it's a great facility. Let's check it out. Sam, we've been talking about getting together and doing a podcast for a while, so we've come to this amazing facility with the Lanserhof clinic, and I'm just fascinated. I can't wait to have a look around here. But just talk to me, how did you end up here?
Well, I think I was working in the military. I had one of the rehab jobs there, which was excellent, and it's a high volume clinic, and you know, you see a lot there. It's an NHS clinic by its heart, and I was also doing a community MSK job as well. And the Lanserhof team reached out to me. I had known one of the consultants that worked here, and then they reached out to me, got me to have a look around, and I was just amazed at the facilities and the availability of resources that when you're working in the NHS and even the military, you just don't have. I've seen it in elite sport in my years of working at various football clubs, but I hadn't seen it in a clinic setting with an availability to you know, someone walking off the street who might want it. So it was really the opportunity of learning how to manage patients with the level of data and resources that was available here that drew me in, alongside the ability to use and utilize new and upcoming pieces of equipment and treatment protocols that really I hadn't seen or used before. So it really excited me, and the opportunity to become head of performance here and lead this department with some excellent staff, you know, I couldn't say no to. You know, it's in the heart of Mayfair, in a beautiful place. It's a really nice place to work. There were so many factors that were going well for it, and it really has allowed me to expand and improve my ability as a clinician because of the exposure that I'm getting here.
And then in terms of how this compares, you've worked in the NHS, and things have really shifted in the last few years where a lot of our work was NHS based prior, whereas it's becoming less and less, particularly in the sports medicine MSK world. So where do you see places like this? I know we're in one of the most prime real estate parts of the world, but like, where do you see this sort of setup fitting within that new world of MSK?
Yeah, I mean, I don't think it fits within the community MSK model in any way. I think, you know, when you have high-end equipment and resources that cost a lot of money, they need paying for, and it doesn't fit within that public system. But what it does allow is for learning. By having an increase in the volume of things that go through this place, you get more data that you can utilize and apply to the public system. So I think it probably fits on top of the public system in the private sector that way. And the private sector is growing, and I think a lot of things are moving towards that insurance model in healthcare, whether that's right or wrong. I think that's what's happening. And really what I was finding in the NHS particularly, especially in the community MSK clinic, is patients coming to me very late. I wasn't managing acute musculoskeletal injuries, and I wasn't even managing subacute or a mid-term musculoskeletal injuries. People were coming to me 6, 8, 9 months down the line from having their initial complaint. By that time, the problem had completely changed or become chronic. Their movement pattern has changed, and you're not managing the same conditions at all. On top of that, the availability of resources is so poor that you really struggle to manage patients in the correct manner. You can't investigate them in a speedy manner, you can't treat them in a speedy manner, and then when you go to treat them, a lot of the time you don't have the availability to treat them with the right type of things, and they end up, you know, probably heading towards surgery more often than they would do had they been seen earlier and or in the private sector. So I think there's a lot of moral injury that occurs in the NHS that people have to struggle with, and some of my colleagues that still do that and are doing some excellent work there, you know, still struggle with that day to day. And I think finding ways that we can improve those earlier resources, those earlier metrics of changing through things like this is what's going to be the future.
Brilliant. No, can't wait to see it. I know a couple of your colleagues are going to be helping us out with some demos, so thank you for inviting us down.
No problem at all.
So some of the kit I recognise in here, And so I work with Biodex for 6 years, so I'm very familiar with the dynamometry that you've got there. So what things are you using that for?
Specifically to right now with the current patients and members that we have in this building, we primarily use it for strength assessments. We use that as a tool to understand what's their current strength level, specifically lower limbs, and we're looking primarily on knees, but we're going to look into ankles and shoulders depending on what kind of background in terms of sports or injuries they might have or they might have. In terms of the medical history, and also we currently use it as with a couple of physios as a tool to address in their specific ACL protocols where are they and what kind of things they need to improve in the gym based on the results that we get, of course. We try to be as much data driven as possible to get as much numbers and quantifying what's their current level of strength or where are they in their pathway in terms of rehabilitation. But yeah, that's purely for Biodex, yeah.
Perfect. Yeah, so that's the one that I am very familiar with, but you've got loads of other amazing kit in here. So that one behind you,
the one behind me is called DEERS. Basically what we do is a posture analysis machine. So I place 3 different reflective markers on the back of the person. The machine, what it does, it will create a 3D model version of their spine based on how the reflections and also the lights, as you can see, they create a line between each, between the skin, of course, and then based on that, we'll create a 3D model version of themselves, of their spine. And then based on that, what we can see is the curvature of the spine, so how much scoliosis, if they have it, how much kyphosis or lordosis that they have, of course, and what's happening in their pelvis as well, in terms of if they're having pelvic obliquity or pelvic tilt, both in standing we do this, and also in walking as well. The good thing about this one as well is also that there is a foot pressure scan underneath, so we can see how much foot pressure that they put while they're standing and also while they walk as well. So we can see whether they need some specific insoles and if the feet are influencing the knees or specifically the hips and the posture itself. And that can be done in 20 minutes, super easy, and you get results straight away. So we have a visual representation of how the curvature of the spine looks like.
Yeah, no, it's incredible. I've seen these when we go to Medica, the trade show in Germany, and we see DEERS have got a massive stand there where they've got the various bits of technology. But I've not seen many of them in the UK. Like, have you used these prior to coming to Lanserhof?
No, actually, this was my first time encountering this one, and as soon as I saw that, I was like, okay, is this actually accurate? Does it give me an image and that's it? Well, it actually gives you an image, yes, but it's pretty accurate. There are so many studies in terms of reliability that they use this, and actually see that there are a few of them actually compared to an MRI, so I can actually see what's the difference between MRI and actually the image of the spine that we get. Even though the MRI is lying down, so you have a little bit of different approach in terms of the spine itself, but you still get the curvature, and that's what they're looking for specifically.
Yeah, no, it's incredible. It really is incredible. So what else have we got in here?
Well, we go over there, this one over here, this big chair is called Pegasus, and it's a machine that we use it to assess the strength and the flexibility of the trunk. Specifically, the part of the spine is the thoracolumbar spine. What we do over there, because it's a test that we use it in mainly isometrically. So basically what we try to do, and all these cushions that you see over here, shoulders, pads, and also hips as well, they have pressure sensor. So every time you're going to move in different direction of the trunk, they move, which is sagittal, frontal, and transversal. So we get 3D model, 3D version of their strength, let's say. We can detect how much force they can produce between each part of their core and also lower back muscles, of course, as well. So that based on that, we have an idea of how strong their core and the lower back is, and then of course we can then give them a prescribed training plan to improve those things. And also it does measure the specific rotation, side flexion, and flexion and extension angle of the spine itself. So even though you're seated, you're fixed over there, you still get great data out of that.
So for people coming through, like when someone gets referred to you, do they tend to have some sort of issue, or is it I know you've got that club and membership?
Yeah, I mean, in the membership, most of these testing are included. Depend what kind of background, as I said to you at the beginning, what kind of background that they have in terms of sports, and what kind of background of any medical history that they, of course, have in terms of concerns. This is most of the time I see primarily people that don't have any specific injuries, specifically for this type of testing. But if they have some lower discs issues, of course, then it depends what the medical consultant will then give me the protocol to do, because most of the time all these people comes from, before coming down to me, they see one of our MSK doctors or our physios, so then based on that we can then prescribe you a more specific test to do with this person. And yeah, so this is purely general population most of the time, but of course we can go into more in details depending what kind of person we have in front of us.
Perfect. Right, let's keep working around. What else?
There's one over there in the corner. It's called Minotaur, and it's actually a cervical spine machine. What we do is testing similar to Pegasus. We're testing the strength of the cervical spine in forward flexion, so in sagittal, frontal, and transversal plane, and we test the rotational in terms of flexibility of the neck as well. So then over there, we similar to the one before, we do an isometric strength test in every single direction, so we can do that in the most safest way and the most accurate way to address the musculature around the neck. Now it's becoming bigger and bigger, the neck strength related to concussion, so you need some data, of course, to back up what kind of protocol you're going to do with the person that maybe had a concussion before, or maybe it's a rugby player that they want to prevent a concussion, so then they want to train properly the strength of the neck.
So that's a rehab tool as well as a
training.
as a
Both of them,
diagnostic.
funny enough, they're actually a training tool as well. So they can be utilized to prescribe specific training for specific part of the core, or of course musculature around the neck.
And are they training tools from an isometric perspective, or is it from isotonic as well?
Unfortunately, just isometric. That's how they work. So,
okay.
And most of the time, that's the, let's say, the safest contraction that you can do, a muscular contraction. So in that way, we know that they're not going to get injured out of the training or the maximal test, of course.
Great, lovely.
Last one over there is called Centaur, and that's where is a core assessment machine, basically similar to the one before that I said. All those cushions have different pressure sensor. I apply them against, of course, the body of the person, and then what I do, I basically move the person side to side, rotating left and right, and based on those rotations and those movements, I can see how good they are in activating their core. So that what it gives me is a brief image of how the core looks like, and also what kind of things then we need to work up, let's say, in the gym to improve the core activation, and also making sure that everything is quite strong and able to fire up, let's say, in this way.
So, I mean, you've got some incredible stuff in here. Who puts this together? I know how much tech there is out there, so how do you end up with these 5 or 6 bits of technology?
Well, funny enough, our previous medical director has a background in orthopedics, so then he decided to go more in details with that and find a way to relate all those pathologies and then try to find a way to quantify and as much data as possible to then create a proper training protocol for the people that have those type of pathologies. Also, then these are for the people, as we said, that they have pathologies and MSK concerns, but also can be utilized for athletes. And that's where the direction that we want to move more is not only people that have musculoskeletal issues, but also people that are healthy and actually wants to improve their performance and improve their lifespan. So then it's not only related to pathologies, but it needs to be then definitely moving to the people that actually wants to get healthier and stronger.
The thing here at Lanserhof, for having all these pieces of equipment, it's all well and good individually to collect data on strength and movement patterns, but it's really the combination of the different various pieces of equipment that we can use and utilize to plan rehabilitation for patients who have musculoskeletal injuries, but also to quantify metrics for athletes. And we're really providing the same level of care that athletes get to a regular person or someone who wants to get moving, and that could be anyone down from your grandma who wants to just keep moving, who's got a bit of pain in her knee, up to an elite or sub-elite cyclist who is going on a road race and is got really high metrics and got a musculoskeletal problem from there. So I think it's really varied in what you can able to be applied to different problems, but also really it's about utilising the right type of data in the right person. Not all data is needed, but if you can get the right data to the right person, we can really, really improve their metrics, not just for lifespan, as Edo mentioned, but for health span purposes as well, and achieving true musculoskeletal longevity in that manner.
Okay, so now we're in the, do you call this the biomechanics lab?
We call it movement lab, yes. I mean, you could call it biomechanics, but it is also not biomechanics because we do physiology testing as well. So that's why we...
Very good. So what should we start with here?
Well, we go, as you can see on the left side of the room, we go 16 infrared cameras. What I do thanks to that and these reflecting markers, what I do, I create a 3D model version of yourself. So basically over there I can see, because I'm going to make you walk or run on a treadmill, I can see both your kinetics and your kinematics. The kinetics, of course, comes from the camera. The kinematics come from the camera, and the kinetics come from, of course, from the force platforms that we have underneath the treadmill. And then this is they can be utilized for both population that have some musculoskeletal issues, specifically lower limbs that affect the way that they walk and the way that they run, in case they're running, but also can be done for runners, specifically if they want to improve the way that they're running, and also checking if the way that they're running is actually going to be the optimal for them, and also making sure that they're not going to injure themselves because they're running in that specific way. And the good thing about this is, as I said, we can detect the kinetics, which then we can then understand how much force goes through the ankle, the knees and the hips, which then we can understand if there is too much mechanical stress between the three major joints. And then also based on this, we can create a training plan to improve any of those specific stress that person can get out of those joints.
So in terms of data, like I've been to several labs, but most of this setup, like we're in absolute prime central London here, and you've got this full kit here, which is quite remarkable. And in terms of data points, we were talking earlier about how you actually utilise data, because you've got some amazing machines. You've got a really impressive full qualities lab here as well. In terms of data, how do you pick the right data for it to work and help Sam guide in terms of treatment?
I mean, that's one of the things that we try to do is understanding what's the person's background in terms of what kind of sports they're coming from, what kind of things they're looking for to improve in their life. And based on what their medical history looks like as well, then we can go and specifically focus on if they had, let's say, for example, some ankle issues back in 20 years ago that never changed in terms of they never did any rehab on that we can probably still see they still affecting the way that they walk or the way that they run. And then based on these things, we can then create a specific training plan, but also we can then filter all those data to make it specifically for the person that we have in front of us. So I can give you all the data about your hips and the knees, but maybe they actually find that you don't need to know these things, and then you're gonna probably shift your focus too much on them rather than actually the actual issue, which could be your ankle. So I'm going into that direction in that way.
Perfect. Great. And you're stood on some 3D force plates?
Yeah, these are like two big force plates over here that we can utilize it for squat assessment or jumping assessment, even though the ceiling is not that high. Funnily enough, we have some portable force plates upstairs in the gym that we then utilize it with a higher roof to do more sport-specific tasks and tests, of course, as well.
I mean, we've seen an explosion of force decks, valved, strength by numbers type kit recently. Whereas 3D force plates, again, they're typically found in the lab of a university or maybe some sports teams, but even then they tend to be 2D. So can you give a short explanation of how 3D does differ to 2D, just in terms of the applications as to the crossovers of them?
Well, the good thing about having these ones here with the cameras as well, then we can actually analyze the way that the jump, not only from a specific, let's say, if you look at those 2D force plate, you get just the force output, but then because the 3D one are included in the full motion capture system, we can actually understand the way that the squatting properly, the kinematics, but also how if biomechanically they're moving optimally for their joints.
So, what are you? I know Sam's been on this prior to me coming in. So,
Yeah.
what have you got here?
So we do a range of physiological testing. So the one that most people are going to be most familiar with is the VO2 max test. So looking at your cardiovascular fitness. I think a lot of people think it's purely a performance metric for elite athletes. But here we really recommend it for everyone to get tested. There's been studies since about the 1980s that have linked VO2 max to all-cause morbidity, all-cause mortality. So especially now as we're trying to live healthier, live longer, VO2 max is one of those metrics that everyone should be getting tested and working on improving for their overall health, not just for athletic performance.
Great. So typically then, for someone, say like Sam who's talking about, he's got this cycle ride coming up, how does something like this benefit him?
So with the VO2 max and also more specifically the lactate threshold test that we do, which is sort of the gold standard for personalised training zones, we can then give our clients those specific training zones. We can also see where those weaknesses lie. So are you a lot better at doing high intensity exercise, but you don't really have that zone 2 aerobic base that you need as sort of your foundation? Do you need to maybe tailor more of your training towards that? Or is it the opposite? Have you never really done high intensity because it's been hard and who wants to push themselves to do that? But do you actually need to build that maximal effort intensity to increase sort of that VO2 max and that anaerobic capacity? So with the test that we do, we can give either on the treadmill, so your speed and your pace that will get you for that heart rate and target those specific areas, or if you're doing it on the bike, we can look at your wattage and your power output. So you'll get sort of a speed or power output metric as well as a heart rate target zone that you can then take into your training to make sure the training you're doing is going to be the most beneficial for you and to see that adaptation and that improvement in performance.
Yeah, it's great. It's really cool. And you see High Rocks is just exploding everywhere.
Yeah.
So is that something that is those sort of people that are coming through here that you're helping them?
Absolutely. One of the clients I've worked really closely with, he was doing High Rocks, so he came to us after he'd completed his first High Rocks and he'd signed up to do a second High Rocks in 3 months' time. So we did a lactate threshold test. He was specifically struggling with the running aspect of High Rocks. Obviously, you have to do that 8 times. It's not just like one of the stations. If you're bad at the sled push, you can get away with it. But if you're bad at the running, you've got to do that repeatedly. So it's really going to drag down your scores. So we worked at improving that intensity, doing longer interval type training, as well as building up his endurance capacity. Again, using that lactate threshold to guide those training zones. When he then completed his High Rocks 3 months later, he saw an over 12-minute PB. We also saw like a 4.5% improvement in his average run time, so his average split. And then we also looked at best and worst run time. So his worst run time had gotten 21% faster, and then his best run time had also gotten 16% faster. So that again is just showing how using those target zones and making sure your training is working for you can help you get those performance gains.
Awesome, yeah, real impact. Brilliant, thank you very much.
You're welcome.
So I think the beauty here at Lanserhof in having all of this mixture of physiology and biomechanic testing equipment is actually the staff as well. You know, we've got really high level of staff here who really know their stuff. And in doing so, when they provide data, they can interpret it in a manner that we can actually deliver quantifiable actions to patients. You know, it's all good, you know, pumping out a VO2 max and then getting the markers and levels and knowing your numbers. A lot of people can do that, but interpreting that for the patient so they can have actual actionable improvements in their longevity and their performance is what we do here. That's slightly different to other places. Similarly with the biomechanics, interpreting those joint kinematics alongside the strength stuff really helps me as a clinician be able to plan that rehab for the patient, plan the intervention that we're going to do. So, you know, it's holistic team-based care that we do here that really makes that difference. So alongside the movement lab and the spine lab, which we've already been to, we also have a 3T MRI scanner in-house, and this gives really high quality detail in terms of looking at people's joints, muscular tissue, tendons, ligaments, and really, you know, it's the high end of imaging. And when we attach that to all these data that we're putting before, we're then really getting that integral data that we can use to manage patients. We also have a cryo chamber across here as well. That's more of a wellness device that some people really like to use, but actually I found that can be really helpful in settling people down who have a real focus on chronic pain and back pain. Taking that sensitization away sometimes can really be helpful, and a couple of minutes in the cryo can really make a big difference as well. And if you're coming in, I'll show you inside. So the cryo chamber goes to minus 110 degrees. As you can see, it's on at the moment. It's absolutely freezing in there. We'll maybe get you going in for a couple of minutes, Andy. What do you think?
Well, it's a...
Fair enough. Obviously, we check the temperatures before and after. We also do a blood pressure most of the time, and we've got to protect the outer limb. So everyone who goes in wears some gloves and headwear as well. But yeah, really useful metric for wellness in general, and sometimes for the members anyway. They can come in here once a day for 2 or 3 minutes, and apart from that mental load and clarity that it provides, it can actually provide a shock to the system that can get rid of some chronic pain metrics as well. Lots of really good studies in cryo and how it can help.
So would people, they could literally just come in, nothing wrong with them, and they'd see benefits from that?
Yeah, so I think that's more anecdotal in terms of the evidence base for that, and more based in wellness than in actual medical correction of any problems. But certainly there is a lot of this anecdotal evidence that people who are well within themselves doing cryo regularly can reduce some of that mental fatigue that they get and sharpen their mind. So people go in it just for that. But I actually find in people that have, as I say, chronic pain, back pain, cycling in some cryotherapy as part of their treatments can really help offload some of that pain sensitization that they feel as well. So really useful. And a little tip I use, we've got the availability here. It's not available everywhere. So we try and use some of the stuff that we've got available when it's there.
Class, thank you.
This is Lanserhof at the Arts Club. It's a combination of Lanserhof, which is a wellness company from Germany, and the Arts Club, which is a members club across the road. And it's its own bespoke wellness club in its own right, and actually a fully faceted medical clinic as well, with a host of different specialties and a performance lab, which we've had a look at downstairs already. Here is the members lounge area, so I'll just take you through. And in the members lounge area, the beauty of it is members can come in and sit in, relax, have some food, and some of our members even have food and wellness plans curated by our chef and curated by some of our staff members as well. And what that does is it allows us to really plan their health in a way that is targeted to their health metrics, which we probably assess through blood tests and MRIs and various manners. And we do full body composition MRI scans as well, looking at body composition, fat levels, muscle levels. We've got a gym upstairs with the training equipment, and when we combine that with accurate nutrition, we can really get a feel for true wellness in all aspects. A level of holistic care you can't get in every place, and that's what we try and provide here at Lanserhof. This is the Lanserhof at the Arts Club gym. At the heart of this place is a members club that is a gym base, and it's got a really bespoke gym where we use very specific techno gym equipment. All members have a wristband that they wear, and it measures all their metrics across time. And each of them will have a personal trainer that is assigned specifically to them that they can ask questions to regularly and have sessions with, but also monitor them across time. And alongside that, we've got strength and conditioning coaches, physiotherapists, rehab specialists as well. So when I see a patient and I want them to have a specific mode of rehabilitation, I know exactly who to send it to for whichever problem there is. And we've got various pieces of equipment, including your favourite valve force decks, alongside some functional testing equipment, some excellent and random body testing equipment as well as a view of Victoria Beckham's shop through the window as well. So you can't lose really, you can't lose at all.
It's an amazing building, isn't it?
Yeah.
It's got a very French feel to the building and the architecture.
I don't know whether, I mean, it's German in nature, but I think essentially it's European in its build. High ceilings, flat, sharp walls, and the idea is to give people a feeling of wellness when they're training as well. So it's nice, it's probably luxury, not necessary for anyone to really need to get fit, but when you're in the heart of Mayfair, the heart of London, that's kind of what the people around here expect, so that's what they offer here.
So who tend to be members here then?
So, I mean, it tends to be professionals that work in the area more than anything. But living and working in this area, and you want a bespoke kind of small gym space that isn't overly busy, that has that high end of clientele that you want to associate with. That tends to be the people that come here. We do have members that are also members of the Arts Club. That come across here as well. It's a separate membership, obviously, and some celebrity clients that want some privacy would like to come here as well. So it's a mixture. It's open to everyone to purchase, and it's not overly more expensive than any of your other high-end gyms such as Third Space and Equinox. But it's a little bit of a secret place that not many people know about, and I think that's the beauty of it as well. Really, there's not really anything missing as such, that has all the pieces of equipment that you could possibly need. And because of the data and the measurements you can take out of it regularly, people really see generic and continuous improvements without having to do anything themselves in terms of monitoring their own gains. That's all done by this piece of equipment here. So it's got that kind of the fob that every person puts into each piece of equipment when they're going, and they can monitor it across time. So really, really useful that. As I say, it's got 5 floors. I always try and make sure everyone walks up the stairs as much as possible and gets their steps in. But it's got this kind of weird German architecture, which, high ceilings. Again, it's just that feeling of luxury that isn't totally necessary, but adds to that feel of wellness that people like to see. So, second floor. We have a studio in here. We do some yoga classes. We do some personalised physiotherapy. We have the group Remedy. I don't know if you know the physiotherapy group Remedy. But they have a spot in there, and they see individual patients alongside this personal training studio that we have over there as well.
That's Freddie, isn't it? Is it?
Yeah, that's Freddie Murray, yeah. So, we do some Pilates in here. Are you about to do a class? No. Oh, you fit? Okay. So yeah, so we've got some Pilates in here, reformer Pilates, as well as some bar stuff. So they run quite a few classes in there. As I said, there's a personalised training studio in here, but we use this for personalised physiotherapy. So the Remedy group tend to do their stuff in here, but also we have personalised physiotherapy sessions that go on in here as well. And it's just another space that can be closed off. These walls are movable, so if you want the class to be a big class, we can also move that back as well and have a bigger class. But really nice open space, high ceilings again for some of that equipment. And if you look on the ceilings over there, you'll just see they've got those hooks as well. So they also do some of that crazy hanging stuff as well. These classes that people love to have. Not for me personally, but certainly giving you the option and the various type of exercise and wellness that people like to have. So we have various clinicians here. Our head of medicine, a medical director, Ray is a gastroenterologist, and he leads a department and gets different clinicians in. We've got a sleep specialist. We've also got a functional medicine specialist as well. And we've got a GP with special interest in women's health and a cardiologist. We've got a hip and knee surgeon that works here as well. You've got myself as a sports medicine consultant and my colleague Bevan as well. We together lead the head of sports medicine here, and we lead the performance department, which I've shown you downstairs. And this third floor is primarily for consultation. So patients will come in and they will wait here and be seen by the staff members, the reception staff that tend to sit over there. Again, it's a really nice open space for people to feel at home, especially when you're members and if you're to come here regularly. So consultation rooms, we've got 2 main consultation rooms and 2 treatment rooms in here. Consultation room 2 tends to be where all the functional medicine consultations happen. The treatment room 1 here is where all the cardiology investigations happen. So in here we've got a ultrasound machine, which we tend to use for the echoes and all the cardiology assessments, alongside ECG and all the health assessments that go on in here. And in the main room, where all the magic happens, consultation room 1, and this is the musculoskeletal assessment room. So this is where the SEM consultants tend to be. And this is where I do all my consultations, examinations, and also any of my injections happen here. And here we've got the ability to do anything from a steroid injection to hyaluronic acid to more regenerative treatments like platelet-rich plasma, which we're finding more and more use for now that we're learning how it works, learning how it can improve and regenerate joints in a functional way, in a pain reduction manner as well. And obviously some newer injections like arthrosamid, which is a polysaccharide hydrogel we've been using to reduce people's knee pain as well. So real big variety of options that we're able to provide here. When we combine that with all the stuff that I mentioned before, we create packages that people really benefit from in the long term, all in one place. Rehab here, 3T MRI scanner here, biomechanical assessment here. Go upstairs and I'll show you that we also do some blood testing here, looking at cellular health, looking at metabolic health, and we can fix that with some of the diet protocols we have here as well. So really doing a holistic measure, despite just looking at the joint, we're branching out into the whole body to try and fix them from the holistic way down to the whichever bit of pain or dysfunction that they may have. So yeah. Here we are on the 4th floor. We've got the infusion suite and treatments, and this is where, if I want any of the patients to have blood tests, they'll come up. And herein lies the true beauty of having everything in one place. So a patient can have their blood test done, and we can look at their cellular and metabolic health. Downstairs, they're looking at their biomechanics, their strength assessments, their VO2 max, how fit they are, their cardiovascular health. And the thing is, if when you're managing someone who might have a singular joint pain in one area, looking at the whole body in a holistic manner can really help us manage that patient better. It's not just the joint that's causing pain. It might be that they've got chronic inflammation. It might be that they've got a reduced amount of fitness, a reduced amount of muscle health, and actually being able to manage all that thing in one place really, really can benefit the patient. We've got more treatment rooms in another consulting room. The treatment rooms here are predominantly used by physiotherapists, osteopaths, and other alternative therapies. This room, for instance, is where we tend to keep the shockwave machine. We've also got some therapies like cupping and acupuncture that go on in here. We've got a heated bed as well, again for more massage therapy, and a variety of other alternative therapies as well that some patients seem to really value. The benefit of that is we give people the option of what they really want to use, the option of what they really want to value, and they can pick and choose what might help them as well.
So that was an amazing insight into what happens in a high-end clinic in London. So thank you to Sam Botchey and his colleagues and the Lanserhof for hosting. Hope you enjoyed it. It's really amazing to get the insight into what happens at these level of clinics. So I hope you enjoy the podcast.